Hello, I am Gennady Slobodov. I am the residency program director here at the University of Oklahoma. And on behalf of all of our faculty and residents, we want to thank you for watching these recordings. We're excited that you have some interest in our program. We certainly are very proud of what we built here, and we're excited to showcase that for you. As far as just some brief things about the department, we are a very diverse department. We have a lot of young, energetic faculty from various backgrounds. We're very diverse, not only as sort of different ages of faculty, we also have different training backgrounds from all over the country and different fellowships. So that, I think that adds to your all's training. I also think we have a great camaraderie between the faculty, we have great camaraderie between the residents, and I really feel like we have a great environment here at OU. As far as me, I've been with the program for 10 years as the program director, and I've been on faculty for 15 years. So I'm certainly one of the old faculty here in the program. This presentation is meant to be an overview of just sort of the structure of the program and things that we have to offer for you during your 5 years of training here at OU. So as far as the mission of our program, we definitely want to focus on the 3 pillars of academic medicine, which is clinical care, education, and research. And we take these 3 pillars very seriously. The vision of the program is to stay on the cutting edge of medicine and urology, and we want to deliver the future of urology today, and we definitely want to train the leaders of tomorrow. This health science center that we're located has been around for over 100 years. It has changed dramatically over these 100 years, and it certainly has changed dramatically just over the last couple of years. So some of the changes that have been happening on campus includes a new patient tower. The picture of the new patient tower is shown right here at the center. We just started working there. I had my patients there for the first time yesterday. And so really most of your training when you are on that rotation will be happening in this brand new facility. It is a state-of-the-art facility. The operating rooms are beautiful. The patient rooms are beautiful. There's a lot of space for resident teaching and group rooms and stuff like that. So we're extremely excited about bringing that facility online and making it a big part of our urology patient care and resident training. The groundbreaking for this facility happened in 2017. And the tower is now open. So these were the rendering shots in this presentation, but it's there and it's ready to go and it's ready to provide great care for our patients. As you will notice, this tower, the new tower, is right next to our old adult tower, which you can see at the bottom of the screen. So the facilities are connected. It increased our capacity, it increased our ability to take care of the patients. These are just some renderings of the rooms of the new facility. As far as the structure of the program, as you can see at the top there, Michael Cookson is our chairman, and then I am the program director. Brian Cross is the associate program director. Jonathan Heinlein is in charge of medical student rotations, and Dr. Kelly Stratton is in charge of clinical research. As far as subspecialties, really most of the subspecialties are very well represented by our faculty. Most of our cancer faculty have their practice at Stevenson Cancer Center, which is here on campus. So you could see we have a lot of urologic oncologists, specifically 7 of them that are working with us every day. As far as other subspecialties, you will see that just about everything you want to do is well represented by our faculty. That includes men's health, infertility, andrology, reconstruction. We have some outreach clinics that we have. One is in Edmond, which is about 15 minutes north of our main campus, and one on the south side, which is about 10 minutes south, where our faculty go and have practices there. As of right now, the residents really only participate in our Edmond clinic and Edmond Hospital, where they have a community rotation with Dr. Bowen and Dr. Ross and Dr. Renzi. And that has been a great addition to the training of the residents since they get experience of what private practice may be like. Our pediatric urology faculty includes Dominic Frimberger, who is our chief of pediatric urology, and then we got Dr. Balaji Sundaram and Adam Rensing, who work here at Children's Hospital. We are very active at the VA Medical Center. As you could see, most of our faculty participate in patient care and training of the residents at the VA hospital. Dr. Andrew McIntosh is our chief of urology at the VA, and he's urologic oncologist who just joined us recently and received his training at MD Anderson. So we are very excited about the VA rotation. We have multiple advanced practice providers, as you could see, in all of our clinics. Currently, we don't have a lot of mid-level and advanced practice providers in the hospital, but that may change by the time you arrive. As far as resident goals and objectives, really they're pretty standard for all the years. Now, obviously, there are rotation-specific goals and objectives, but the general things that you need to be aware of is that we definitely focus on patient care, and we want to make sure that we provide that care while focusing on the patient and also making sure that we're cost effective. We want to be sure that you guys are well trained in all of the ACGME core competencies in their application into urology practice. You will be not only learners, you will also be teachers to your junior residents and to the medical students that will be on rotation. We want everybody to participate in research while you're with us. So there's a minimum requirement of 2 published papers as a first author and 2 presentations at national or regional meetings. Even if you're not interested in that, we still would like you to do it, because sometimes your plans may change and you may want to pursue a fellowship, and therefore we want everybody to be prepared to do that. The duration of our program, as you know, is 5 years. You will spend 6 months of that first year on general surgery as PGY1. Your rotations on general surgery may change, and they change them every year based on the feedback from our interns. Currently, the 6 months rotation on general surgery includes surgical oncology, minimally invasive laparoscopic surgery, emergency general surgery, colorectal surgery, and then you're going to do 2 months of trauma ICU and trauma rotation. 1 is days and 1 is nights. So that's your 6 months on general surgery, and then the other 6 months you'll be spending on urology service. And that will be rotated between VA Medical Center and our main hospital, OU Medical Center Team 1. During that year while on urology, you will not be taking any call. You'll be working on some of the basic urologic procedures to make sure that you're competent in those. While you're on general surgery, then you'll be taking the assigned call that you would as if you're a general surgery resident. During your PGY2 year, your time will be rotated between a Presbyterian Hospital, VA Medical Center, and then there's a 3 months rotation where you're sort of a flex resident that rotates between Team 1 and Team 2 in our main hospital. During that time, you'll be taking a first level home call, and that usually ends up being about Q7. During your PGY3 year, you'll still be in that same call pool, so that's why it ends up being every 7th night, and your time will be rotated between Presbyterian Tower and between Children's Hospital. During your PGY4 year, you'll as well be at Presbyterian Tower, and you'll do a children's rotation during which you'll be the chief resident on that rotation. During your PGY4 year, you'll be taking a 2nd level home call, which is usually every 3 to 4 nights. You'll also be taking some outside calls from patients. During PGY5 year, your time will be split between VA and Presbyterian Tower. You'll be taking 2nd level home call Q3 to 4, and you'll also be taking some outside phone calls. So that's kind of the outline of the rotations and the call schedule. We do not have any in-house call at this time. We have a lot of didactic conferences that you'll be participating in. Now, you will not be participating in all of the conferences that are listed on the slide. during certain rotation, you'll be doing certain conferences. There'll be a couple core conferences that we all do as a big group. So we will obviously do morbidity and mortality together. We do high yield faculty presentations. We do grand rounds. We do resident indications and assignment conference all together to discuss the cases for the weeks. We are ACGME accredited program. We have been accredited since 1947 and have had full accreditation since then. So we're in great standing as it comes to ACGME. We have had really no issues as far as that goes. Our program performs well. Our residents do great on in-service scores. We beat national average when it comes to that. Our 2019 graduates have all passed their board 1 and they were in the 5 out of 5 quintile. It's been a really long time since anybody has not passed their boards. We've continued to be very active at our regional meetings. We've had 9 presentations accepted to our South Central section. Our program provides a lot of support for the residents. We pay for your AUA annual membership. We provide you iPads. We pay for your surgical loops. We pay for your board review courses when you're a chief. If you go to a meeting, then your travel gets covered if you're presenting. You'll be receiving departmental logo jackets. You'll get white coats. We'll be paying for all the educational material you need, such as CSEPs and AUA. We provide a very competitive salary, considering that you're in Oklahoma. You should have a very good lifestyle when you're here. You should be able to do things that you want to do. And so the salaries are listed right here. As you could see, we're a relatively diverse group of students that have matched here in the past. So this sort of gives you a list of which medical schools the applicants came from. As far as social life, as you could see, we have really about half of our residents are now married. The number of singles have decreased for some reason. So, but that doesn't matter. We have a great core of residents. If you're single, that should work out great. If you're married, that's fine too. We are certainly not looking for any sort of specific social arrangement. As far as alumni, people that have graduated from our program, as you could see, these little boxes represent alumni that are around the state of Oklahoma. And we have 42 urologists that are currently practicing that were trained by us. But just because you train here doesn't mean you have to stay here. As you could see, our graduates are distributed all over the country. They are on East and West Coast. They're certainly in the Midwest and South. So we have graduates all over. So you by no means would be limited by coming here to just stay in the, Midwest or South, et cetera. So we should be able to provide you the training to do what you need to do moving forward. So really, we're very excited that you're looking at this program. We have a great program. We have supportive attendings and staff. We will push you to be your best. And you'll have unlimited options when it comes to fellowships or academic practice, if that's your goal. But if you don't want to do that, you'll be just as well prepared for private clinical practice. So thank you for your time. Good luck with the interviews. And we're looking forward to you guys to learning about our program. Thank you very much.